I recently saw a patient in the office for complaints of like a burning tingling over the front thigh regions, and a little bit of back pain as well, but there really wasn't any cramping pain down the legs itself, and no other symptoms. Examination was completely normal, no neurologic deficits. The patient did come with an MRI, and the MRI showed that there was a little bit of degeneration of the lower disc, with a little bit of slippage of the spine, like a 1 to 2 millimeter offset. When they did flexion extension x-rays and bend forward and backwards, the spine does not move. And when you look out under the joints, there's a little bit of narrowing where the nerve goes out, particularly on the right, but no spinal stenosis or narrowing of the spinal canal itself. And so to me, it didn't really make sense. I mean, the distribution of symptoms is over the front of the thighs, and where the nerve may be pinched at that lower level on the right really didn't fit the pattern of the patient's symptoms. So for me, that's kind of like a red flag. So I said, I wouldn't consider surgery yet. I'd like to do a little more workup. And so I recommended getting an MRI of the thoracic spine higher up to make sure there's not some abnormality or pinching of the spinal cord higher. And also to check a nerve study of the leg to make sure it's not a neuropathy, which is a problem with the nerve itself in the leg and not so much in the back. And so once we check those things and get the results, then I can determine, is there something else causing the symptoms, or could it be that lower level? The patient was sent to me as a second opinion. Apparently surgery has already been recommended with a fusion, but that may be the case and that may be what that person needs. But for me, I just want to make sure there's not some other reason that's causing the symptoms, just because the patient's symptoms don't fit what I see on the films as of yet. And it doesn't mean I'm right or wrong or someone else is right or wrong. It's just the way that each doctor practices. And in my practices, I like to rule out every other possibility first before I move on to surgery. And so that's what we're doing with this patient.